Good morning, everyone. Thank you for coming to today's presentation, What to Know About Meningitis. Today's presenter is Dr. Jason Kendler. Dr. Jason Kendler is an infectious disease specialist. He is affiliated with New York-Presbyterian Hospital-Columbia and Cornell. In this presentation, Dr. Kendler will discuss what we need to know about meningitis. So next voice you'll hear is Dr. Kendler. Thank you.
Thanks for the introduction, and thanks for allowing me the opportunity to speak with you today. My name is Jason Kendler. I'm a specialist in infectious diseases. My training is also in internal medicine. So I did an internal medicine residency at New York-Presbyterian while Cornell. That's a 3-year program followed by 2 years of an infectious disease fellowship. And I currently do a lot of teaching of the medical students at Cornell. So I always welcome the opportunity to speak and share medical knowledge with people. And I have a private practice in general internal medicine where I see patients of all ages with all kinds of problems. But for today, we're going to talk about meningitis. Now, meningitis is a true medical emergency. It's a true infectious disease emergency because this is a type of infection that needs to be identified very, very quickly and treated very, very quickly. Otherwise, the outcome can be dire, as we'll talk about. Okay. So, what is meningitis? Let's start there. Meningitis is an infection of the meninges. Okay. The next question: what are meninges? Meninges are membranes that surround the brain and the spinal cord. Okay. So it's almost as if the brain and the spinal cord are encased in like saran wrap, like this fine layer that actually protects the brain and the spinal cord. And there's some fluid within the meninges called cerebrospinal fluid that bathes the brain and bathes the spinal cord. And this helps protect against injuries. If you hit your head, if you bang yourself, it helps to absorb some of the shock. And there's some other functions, but the meninges are basically these membranes that surround the brain and the spinal cord. Okay. And here's a picture. So again, you have the skull, the outer skull, which is hard layer, and then you have these meninges, which basically surround the brain and surround the spinal cord. Okay, just to show you a picture of what that looks like. Okay, and then this fluid, the cerebrospinal fluid, as I said, is within the meninges that helps sort of bathe the brain and the spinal cord. So as I said, the function of the meninges is to cushion the brain and the spinal cord. Okay. So there are, in general terms, there are 2 types of meningitis. There is viral meningitis and there is bacterial meningitis. Most of my talk, I'm going to focus on bacterial meningitis, which is the more serious form. But viral meningitis actually is more common than bacterial meningitis. Okay, so viral meningitis is a milder form of meningitis, as I just said. This is something that occurs in this part of the world in the late summer and early fall. Okay. Viral meningitis is something that does not require treatment. You would certainly like to make a diagnosis of viral meningitis, and you certainly want to make sure that someone who's presenting with meningitis doesn't have bacterial meningitis. But patients with viral meningitis in general will get better without any treatment. The body's own immune system will fight off the virus. Okay. Bacterial meningitis, which is really going to be the focus of my talk, is the more severe form of meningitis. Okay, and this is the diagnosis that it is crucial to make immediately. Okay, patients need to be diagnosed immediately and treated immediately, and we'll talk about some challenges to that later on. And the reason is that patient can develop lasting damage as a result of meningitis, or patients may die from meningitis. And in terms of damage, patients with bacterial meningitis can develop hearing loss, which may be irreversible. They may develop brain damage, such as a stroke. They can have seizures, and in some severe cases, other organs can fail, such as the kidneys. Okay. So there are many different types of bacteria that cause bacterial meningitis, but the two most common causes of bacterial meningitis that someone may obtain or require in the community are pneumococcal meningitis and meningococcal meningitis, okay? How do you get meningitis? So viral meningitis occurs when someone is exposed to the virus. That exposure can occur such as breathing in viral particles that have been sneezed or coughed. It can occur if someone touches surfaces that are contaminated with virus, and then perhaps a hand that has touched a virus then touches the mouth or the nose, then an infection can occur, or contact with fecal material. Okay, so in someone who changes diapers and doesn't wash their hands, or someone who's infected who doesn't wash their hands properly and handles food, viruses can be acquired in that manner. All right. Bacterial meningitis is a little bit different. You get bacterial meningitis. Oftentimes, this can start as an infection in a different part of the body, such as an ear infection, a sinus infection, or a lung infection, which is pneumonia. Okay. Bacterial meningitis, and in particular this meningococcal meningitis, which we'll talk about later, that often comes in the form of outbreaks. So if you're in close contact with someone with meningitis, you can develop meningitis. Okay, and this is a concept that's a little difficult to understand, but some of the bacteria that cause meningitis, either pneumococcal meningitis or meningococcal meningitis, are bacteria that just hang out. We use the word in infectious disease, we use the word colonization. So these are bacteria that just basically hang out in the nasal cavity. In general, they are harmless, but under certain circumstances, so if there's an aggressive bacteria or if there's a breakdown in the immune system, the bacteria that just kind of hang out within the nasal cavity can invade and can cause meningitis. Okay. Symptoms of meningitis, we'll talk about next. Symptoms of meningitis are generally pretty severe, okay? And patients with meningitis will generally seek medical attention very soon after the onset of symptoms, okay? So if somebody has a cold, or a bronchitis or a less severe type of infection, oftentimes as a doctor, I will hear from them 2 days, 3 days, 4 days or such, into the course of their illness. In the patient with meningitis, these patients are usually very, very sick, and the onset and the progression of the illness is very, very rapid, so that these patients will reach out for medical care very soon, generally within hours or a day of the onset of symptoms. Okay, what are the symptoms? Well, the most common symptoms, as you see here, are fever, neck stiffness, and confusion. Okay, headache is also very common. Nausea, vomiting can occur. In some cases, a rash can be present. Excuse me. And there's this medical term called photophobia, whereby patients with meningitis, any amount of light can be irritating. And so patients with meningitis, if you turn the light on in the room, they'll sometimes shield their eyes, okay? And this is called photophobia, and that's a very common symptom in patients with meningitis, okay? I told you that some of the bacteria that cause meningitis can simply hang out in the nose, in the nasal cavity, and so I don't want you to think that, oh my goodness, everyone is at risk of meningitis. This happens to be a pretty rare diagnosis. Okay, so whereas most estimates now show that almost more than half of the population has experienced COVID at this point, meningitis occurs 1 case per 100,000 population. Okay, so this is a very, very rare diagnosis. It happens very infrequently. In my infectious disease fellowship, where you're seeing patients with infection, I only saw a couple of cases of meningitis, okay, because this is something that just does not occur very commonly. All right. So what you need to know about meningitis is that it's rare. You need to know the symptoms that we just went through that are associated with meningitis. And you have to know that meningitis is treatable. And before we had antibiotics, bacterial meningitis was almost 100% fatal. Okay, so without treatment, this can be an overwhelming infection that can kill. Okay. How do you make a diagnosis? So the first thing we as doctors do is we take a medical history. So again, fever, neck stiffness, confusion. Those are the main symptoms that we're looking for. So that's part of what we call the medical history. Next, we'll do a physical examination. A patient with meningitis may be confused. A patient with meningitis may have a fever, may have a high fever. A patient with meningitis may have a stiff neck, so they may not be able to bend their neck very easily. Or you, as the examiner, when you try and bend the patient's neck, you may meet up with some resistance because of inflammation of this membrane that surrounds the brain and the spinal cord, okay? A patient with suspected meningitis will get blood tests, but the diagnostic procedure of choice is something called a spinal tap, or the other name for it is a lumbar puncture. And what this involves is having the patient lie on the side of the bed, of the hospital bed, as you see here, in the fetal position, so with their knees up towards their chest. And then what you do is you feel along the lower back. You're feeling for the bones of the spine, which are called vertebral bodies. And with your finger, you'll feel where the bones of the spine are. You'll find a spot in between two adjacent bones. You will then sterilize that site. You'll clean it off with some solution that kills the bacteria that may be on the surface of the skin. You'll then inject a little bit of numbing medicine, and then you'll take something called a spinal needle, which is a needle that's between 2 and 4 inches long in general, and you'll introduce that straight into the patient's back. And you're going basically through the meninges, and as you go through the meninges, you'll feel a little pop as you penetrate that membrane into a space called the subarachnoid space, and you will then aspirate some fluid. You'll take out some fluid you'll take out some of this cerebrospinal fluid that you will then send to the lab for an analysis, okay? There are many things that you look for in this fluid. You're looking for the protein content, the sugar content. You're looking for cells, okay? You're looking for the presence of white blood cells, which you may know are the cells that fight off infection. And normally in the cerebrospinal fluid, there should not be any white blood cells. But if somebody has meningitis, there will be an elevated number of white cells in the spinal fluid, okay? You're also looking at what types of cells there are. There are different types of white blood cells. That can be a little bit helpful. And then you're sending for tests to try and identify which, if any, bacteria is causing the infection, okay? And there are some tests that you can get back right away. There are some other tests like cultures that take several days to come back. But again, once you've done the test, you send the material to the lab, you can know, in a very short period of time, if there are these white blood cells, if there are inflammatory cells in the cerebrospinal fluid, and know if the patient has meningitis, okay? In order to treat a patient with bacterial meningitis, these patients are generally, as I said, very, very sick, so they need to be admitted to the hospital, okay? This is not an infection that you can manage on an outpatient basis. This is not an infection that once you've made a diagnosis that you can send a patient home. And we need to give intravenous antibiotics to a patient who has meningitis, okay? So antibiotic pills are very effective for treating lots of different types of infections. Perhaps you've taken an antibiotic pill for a sinus infection or for a bronchitis and so forth. But for meningitis, the pills are not strong enough. The pills do not give you high enough levels of antibiotic in your system. So patients with meningitis need to be admitted to the hospital for good, strong intravenous antibiotics, okay? So what could potentially stand in the way of a proper treatment of a patient with meningitis? Well, first of all, delay in diagnosis, okay? And so, really, even though this is a very rare diagnosis, clinicians such as myself who talk to patients over the phone or see patients in the office, or emergency room doctors who see these patients who might come into the emergency room, always have it in the back of our mind that a patient may have meningitis, because you really, again, if a patient has meningitis, you really want to know as soon as possible. You want to start them on antibiotics as soon as possible. Again, hopefully the doctor who assesses a patient with meningitis will know which antibiotics to use. And in general, because a patient with meningitis is very, very sick, because there are a lot of different possibilities of bacteria that cause meningitis, we generally start by giving a number of antibiotics at once, okay? It's better to have more antibiotics on board and then cut them out one by one, as you know, as the diagnosis becomes more clear, rather than start with an antibiotic and it turns out that that's the wrong antibiotic, and all of a sudden it's a day or two later, and the patient has the patient's health has suffered. And then one other obstacle to treatment is antibiotic resistance, and the bacteria I mentioned, Streptococcus pneumoniae, in particular, we're seeing increasing antibiotic resistance in this particular bacteria. And so again, this requires some thought and giving the antibiotics, giving a broad spectrum of antibiotics up front, so that you're making sure that the bacteria will be treated by the antibiotics that you've administered. Okay. So I'm just going to talk for a moment about outbreaks of meningitis, because this is what, if you've heard about meningitis before, it's likely that you've heard about meningitis in the setting of outbreaks. Okay, now most cases, of meningitis are isolated and do not occur as outbreaks. Okay, and an outbreak is defined as where you have multiple individuals affected by the same infection over a short period of time. Okay, but about 95% of meningitis cases are actually isolated. Okay, but again, as I said, outbreaks of meningitis get a lot of media attention. You may hear on the news, you may read in the newspaper, oh, that there's an outbreak of meningitis somewhere. And where do these outbreaks occur? They occur in general, and this is generally meningococcal meningitis with these outbreaks. They occur in settings where people are in very close proximity to one another, okay? So you'll hear about outbreaks on college campuses, in dormitories. You'll hear about meningitis outbreaks in military barracks, where you have a lot of soldiers who are housed together. You'll hear about meningitis outbreaks in nursing homes. You'll hear about meningitis outbreaks in prisons. So it really requires a lot of people to be together in close proximity to one another in order for a meningitis outbreak to occur. Okay, and the largest outbreak in recent times, there's been an outbreak in a community of gay men gay and bisexual men in Florida over the last couple of years. There have been over 50 cases of meningococcal meningitis there. And, as a result, and we'll talk about vaccines later, patients who are in this community, patients who are at risk, are advised to get vaccinated, okay? But just to give you some examples of meningitis outbreaks, again, as I said, you typically hear about these in college campuses, okay? And you could go through this list and you could see 3 cases, 2 cases, and so forth. At Princeton University, between March of 2013 and March of 2014, there were 9 cases and 1 death. So this was an outbreak that went over a prolonged period of time, which is a little bit unusual. But again, you're talking about a death in presumably what is, a young, healthy individual, and that's something that can occur in meningococcal disease. Okay, but these are again some examples of outbreaks of meningococcal meningitis in college on college campuses. Okay. Prevention. So one of the things I want you to get from this lecture is that meningitis is preventable. And there was a type of bacterial meningitis that was fairly common in children called Haemophilus influenzae meningitis. And this was a type of meningitis that would occur in children, a type of meningitis that often would result in deafness of children because of damage to the central nervous system, damage to the brain as a result of this infection. And now this is almost unheard of if you ask the pediatricians. If you look epidemiologically, we don't see this anymore because all children in this country get this Haemophilus influenzae vaccine. Okay, so vaccines work, and in particular, Haemophilus influenzae meningitis, which used to be a big problem in children, is something that we just don't see anymore. Okay. There are pneumococcal vaccines. There are two ones that you may have heard of. One is called Pneumovax, one is called Prevnar. And these should be given to all patients who are at risk of pneumococcal disease. Pneumococcal, we're talking about pneumococcal meningitis here, but pneumococcus is also a bacteria that causes pneumonia, commonly causes sinus infections, can cause ear infections, and so forth. So all children younger than age 5 are given this Prevnar, are given a pneumococcal vaccine. And then, for me as an internist, I take care of adults. Everyone who's 65 and older should get one of these vaccines, should get a pneumococcal vaccine, mostly to prevent pneumonia, but also this is preventative for meningitis as well, okay? For patients who are under 65, certain medical conditions will put patients at risk of pneumococcal disease, pneumococcal meningitis, and certain conditions will put patients not just higher risk of getting the disease, but of having a worse outcome if they get the disease. And there's a sort of a long list of conditions that we give to adults who are under 65 years old, a long list of patients with these conditions that patients should receive a pneumococcal vaccine if they're under 65 years old. And you can see patients who use alcohol, patients who have heart disease, patients who have asthma, okay, on the list, patients who have kidney problems, patients with diabetes, patients with HIV disease, patients with certain cancers. Again, these cancers, these conditions put patients at increased risk of developing pneumococcal disease, pneumococcal meningitis in particular. And these are conditions that if the patient were to get pneumococcal disease, they typically would be much sicker, okay? So so we talked about Haemophilus influenzae vaccine in children. We talked about pneumococcal vaccination in children and adults. And then there is a meningococcal vaccine. So this is the other common type of bacterial meningitis. You may have heard the name Menactra or Menveo. In general, the recommendation currently is for all children 11 to 12 years old to get a meningococcal vaccine and to get a booster at age 16. This is presumably to help them as they are in settings where they're in groups, groups of people that are housed together, perhaps in camp for younger kids or college for adolescents and young adults, okay? Patients with HIV disease should get the meningococcal vaccine. Patients who have had their spleen removed are at higher risk of meningococcal disease, so they should get the vaccine. Patients with sickle cell disease should get it. And then military recruits, college freshmen, again, as I told you, the groups that are at higher risk of getting meningococcal disease on the basis of living in tight quarters in groups, okay? And there's a quote unquote meningitis belt in Central Africa. And so any traveler going to to that part of the world should get a meningitis vaccine. And in particular, this is required as devout Muslims who make the pilgrimage to Mecca, because they're, again, large groups of people and meningococcal disease occurs in that area of the world. Those patients should be vaccinated as well, okay? And then there's there are different types of meningococcal disease, and so there's a different vaccine for a different subtype of meningococcal disease called Group B meningococcus, and that's a vaccine called Bexsero or Trememba. And again, this is primarily given to it's often given, it's not required as the regular meningitis vaccine is, but many kids who are going off to college will get this meningitis B vaccine in addition to lower their risk of getting it, okay? And also in terms of prevention, if someone is exposed, if someone is a very, very close contact of someone who has been diagnosed with meningococcal vaccine, if someone is in close contact with someone who's developed meningococcal meningitis, there is an antibiotic that can be given, okay? So if someone is in a dorm, they develop meningitis, all of their very close contacts will be given an antibiotic to prevent them from getting from getting meningitis. And this in turn, in addition to vaccination, is an effective means of prevention. So to summarize the key points I've made during this lecture, what I want you to really take home from this is, number one, meningitis is a very rare but a potentially devastating infection. Obviously, if you have a fever, you should consult with your doctor. Not every fever is from meningitis, and more often than not, fever will be from something else, such as the flu or something else, but always consult with your doctor. But if you have fever, if you have neck stiffness, if you're feeling confused, if you have a headache, you should definitely seek medical attention right away, okay? And then the other take-home point I'd like you to leave you with is to get vaccinated, okay? So if you're in one of the groups that I described earlier and are a candidate for either the pneumococcal vaccine or the meningococcal vaccine, absolutely get it. These vaccines are very, very well tolerated and they're very effective, okay? And I thought I would just leave you with a piece. Perry Klass is a pediatrician by training. And I think this is a very nice piece because it illustrates from the physician's perspective what it's like to assess a patient, which is not always so easy. Assessing a patient for what is a rare but devastating disease. So let me just read this to you, okay? Evening session at the health center, 3 of us seeing patients in pediatrics. My colleague asked whether I would take a quick look at a boy with a fever and headache. In the exam room, the overhead light was off because it hurt his eyes. Remember, we talked about this phenomenon called photophobia. He was lying on the table, but he sat up and answered my questions, and he let me look in his throat, and he moved his head around when I asked him to. We excused ourselves, my colleague and I, and went out of the room. We conferred. The boy didn't look good. Pronounced photophobia, avoidance of light, and severe headache and fever. And although his neck was not actually stiff, he did indicate some neck pain when we asked him to bend it. He needs to go to the emergency room, we agreed. Sometimes it feels as if you spend your career in primary care pediatrics waiting for your meningitis, your leukemia, your dislocated hip, the bad things, the things that cross your mind automatically and usually fleetingly day after day as you examine children, the diagnoses that statistically will come your way at least once or twice over the course of years and years of walking into one exam room after another, okay? These are all very, very rare diagnoses, but diagnoses that as a doctor you have to keep in mind. Fever, headache, stiff neck, photophobia. These are the clinical hallmarks of meningitis, an infection of the membranes that surround and protect the spine. It can be caused by a variety of viruses and bacteria, and the bacterial form in particular can be a virulent, fast-moving infection, an infection that can devastate or even kill a child. It needs to be treated promptly, and to treat it, you need to diagnose it by doing a spinal tap, and to diagnose it, you need to think about it. I know my meningitis will walk in the door in primary care someday, one of those feverish, hard to console babies, or one of those fluish, unhappy teenagers. So you worry about it with every sick child, week after week, winter after winter. Hundreds of cases of influenza and other viral illnesses, fevers and headaches and body aches and sore throats and general miseries will come and go. But at some point, your meningitis will arrive, and it will all come down to whether you recognize it or not. You stand in the exam room worrying about this one particular very important child, mindful of the danger and trying to look the threat in the eye and recognize it, even with the lights off. Again, I think this piece, very accurately portrays the difficulty of being a doctor assessing someone with a very unusual yet potentially devastating disease, and you generally will want to err on the side of caution and just send this child to the emergency room for a spinal tap and make sure that they don't have meningitis, because if they do, you need to treat them right away. Okay. So that is my talk. I have time for questions if anyone has questions.
Thank you so much. That was an amazing presentation.
Thank you.
Feel free to write something in the chat as well, and I can read it out loud. And this presentation was recorded as well, so we'll post it on YouTube to share with friends and family. Thanks, Larry.
Mhm.
Larry said thank you for the lecture, for the tone of it, and for the final reading.
Thank you. Thanks for your attention. Thanks for attending. I appreciate it.
A privilege.
Okay. I'm not sure if Diana Jones, Senior Center, is writing something.
Okay.
It was great presentation. Thank you so much for the new knowledge.
Oh, thank you very much. Thank you. Thank you for taking the time to listen.
Thank you.
That Senior Center always has a group of audience, always arranged very nicely to watch for civics.
That's
Oh,
great.
we are lucky we have one yesterday and today another presentation. Thank you for your support.
You're welcome.
This is Lulame. I have one question. Has there been any meningitis in daycares or senior centers within the last couple of years during this COVID? Have any outbreaks been seen or none?
That's a very good question. That's a really good question. There are none that I am aware of. There are none that I am aware of in recent times.
Because I know sometimes in schools you see outbreaks every now and then. But I'm just wondering, since, but the kids have spent a lot of time home and not in groups. And I was just wondering.
No, that's a very, very good question. Mostly we see these outbreaks, not so much in schools, but like, as I said, in dormitories, where a lot of people are just like living together, a lot of illnesses like flu, and COVID and so forth, those will certainly spread in schools. But meningitis, for whatever reason, generally requires people living together in really, really close contact. Yeah, so you don't see it as much in those.
So there's really hasn't, since COVID, even in the dorms, I guess the number of meningitis that has really gone down. Yeah,
I haven't heard of any. Again, the biggest outbreak right now is what's going on in South Florida in the gay and bisexual community. Like I said, the last couple of years there've been over 50 cases. But aside from that, I haven't heard of an outbreak in a school in a little while.
Oh, okay. And with the outbreak in Southern Florida, have the epidemiologists been able to trace that to other parts of the country yet, or not yet?
It seems to be really isolated to that particular geography. That's right. And when they're able to do that, they can, the CDC gets involved, the infection control people get involved, and they really go after the groups at risk with vaccines, and they can really they can really make a big difference in terms of prevention by targeting the population that is at risk.
Oh, that's great. That's great.
Yeah.
So maybe they've done that, and that's why it's so isolated. That's very good. That's great. That's
yeah,
great.
and also, again, in the settings, in college settings and in military settings and so forth, where people are at most risk, virtually everyone in this country is getting properly vaccinated. So, so that the vaccines work.
Yeah, they do. They do.
Yeah.
They do. And that's a good thing.
Yes, it is.
It really, really is. Because meningitis, it can be because I know I know older folks who had meningitis, and they got it when they were in high school, high schoolers.
Yeah.
And now some of them are in their 80s.
Yeah.
And they have so the meningitis occurred when they were like 16, 17 years old.
Yeah.
And they still have reoccurrence, like memory loss.
Yeah.
Yeah.
No, when you talk about these outbreaks, everyone is always interested in deaths, right? Everyone's like, oh, how many people died and so forth. And you bring up a good point. What we forget about sometimes, or just like the lasting effects that these infections can have, because sometimes the damage to the nervous system, the brain and the spinal cord can be, some of the damage can be irreversible and can stay with someone for a long period of time.
Yes, that is so true. That is
Yeah.
so true.
Yeah.
Yeah, because she's 80 years old and she can't remember certain things, but she says this happened when I was in high school and I had
Yeah.
meningitis, and she goes on and on and on.
Yeah.
Thank you so very much. Very informative. I enjoyed it.
Thank you. Thanks for sharing that story. Thank you.
Okay, there's no
You're
other
welcome.
further questions in the chat, but if somebody emails me, I will send it your way.
All right. Thanks
Thank you
again for your attention. Thank you.
Yeah.
Thanks, Agnes.
Thank you so
Thanks,
much,
Jesse.
and everybody stay safe.
Stay
Thank
safe,
you
everyone.
as well.
Thank you.
Okay.
Bye-bye.
Okay,
Bye.
bye-bye.
Thank you.